Have you ever noticed a persistent urine odor that won't go away no matter how much you clean? Do you find yourself avoiding social situations because you're worried others might smell it? Or maybe you've walked into your loved one's room and noticed this embarrassing issue affecting them? I know this is uncomfortable to talk about, but what if I told you this isn't about being dirty or careless? Listen, I see you. I see the worry in your eyes when you're helping your mom get dressed and you catch that smell. I see the way you've started opening windows more often, buying more air fresheners, maybe even subtly suggesting longer showers. And if you're experiencing this yourself, I see how you've started declining invitations, how you sit a little further away from people, how you've convinced yourself that this is just what happens when you get older. But here's the truth nobody wants to say out loud. This problem is stealing joy from millions of women every single day. It's robbing them of confidence, of closeness with family, of the simple pleasure of feeling fresh and clean in their own skin. And the worst part? Most of the time, it's completely preventable. What many families don't realize is that urinary odor in older women is often preventable, but it requires understanding the hidden mistakes that make this embarrassing problem worse. Today, we're going to talk about something that affects millions of elderly women but rarely gets discussed openly, because your loved one deserves to feel confident and comfortable in their own body. By the end of this video, you'll know the 9 most common mistakes that contribute to persistent urinary odors in older women, and more importantly, simple solutions that can restore their dignity and comfort. Some of these might surprise you, especially mistake number 7. I'm talking about mistakes that well-meaning families make every single day, thinking they're helping, but actually making things worse. If you're here because you care about an elderly woman in your life, comment, "I'm here," below. And don't forget to subscribe to Elderly Health Central for more practical advice on senior care that actually works. Now, let's dive into these 9 mistakes that are keeping older women trapped in this cycle of embarrassment and odor. And I want you to pay close attention, because some of these are going to shock you. Mistake number 1, overwashing and harsh soaps. Let me tell you about Dolores. She's 78, and when she first started noticing occasional odors, she did what most of us would do, she started washing more. Not just once a day, but multiple times. She bought the strongest antibacterial soap she could find, thinking if a little cleaning was good, more had to be better. She scrubbed until her skin was red and raw, convinced that she just wasn't being thorough enough. But here's what happened: within weeks, the problem got dramatically worse. The odor became stronger, more persistent, and poor Dolores was washing herself so much that she was developing painful irritation. She couldn't understand it. How could being cleaner make the smell worse? Here's what most people don't understand, and this is crucial. The vaginal area has its own delicate pH balance and protective bacteria. Think of it like a garden with good bacteria that keep the bad bacteria in check. When you use harsh soaps and overwash, you're essentially pouring bleach on that garden. You're stripping away all the natural protection, and when that happens, harmful bacteria move in and take over, leading to bacterial overgrowth and much stronger odors. Families often think the solution is more washing or stronger soaps, but this creates a vicious cycle that makes everything worse. The more you wash with harsh products, the more you disrupt the natural balance, the worse the odor gets, so you wash more, and round it goes. Instead, use plain warm water or a pH-balanced, fragrance-free cleanser designed for sensitive areas. Once daily is usually sufficient. Your body knows how to maintain its natural balance when you stop interfering with harsh chemicals. But overwashing isn't the only hygiene mistake that backfires. Let's talk about something you probably never considered could be making this problem worse. Mistake number 2, wrong underwear materials and fit. Beatrice discovered this one the hard way. She's always loved her pretty underwear, the silky polyester ones with lace trim that made her feel feminine and attractive. She couldn't understand why some days the odor was so much worse than others. It was her daughter who finally connected the dots. She noticed that the persistent odor was always worse on days when Beatrice wore her synthetic underwear. You see, synthetic materials like polyester, nylon, and even those pretty lace blends trap moisture and heat like a greenhouse. They create the perfect breeding ground for bacteria. It's like wrapping the most sensitive part of your body in plastic wrap and wondering why problems develop. Tight-fitting underwear makes this even worse by reducing airflow, creating an environment where bacteria thrive. Many women stick with the same underwear styles they've worn for decades, not realizing their body's needs have changed. What worked fine at 40 or 50 might be contributing to problems at 70 or 80. Your skin becomes more sensitive, your body's natural moisture balance changes, and suddenly those cute synthetic panties become a real problem. The solution is simple but makes a huge difference. Switch to breathable cotton underwear with a comfortable fit. Cotton allows air to circulate and moisture to evaporate naturally. And here's something important: change immediately if they become damp from perspiration or minor leaks. Don't wait until bedtime to change into fresh underwear. Speaking of moisture, our next mistake involves something most families get completely wrong, and it's probably happening in your house right now. Mistake number 3: ignoring minor incontinence. Vivian's mom was stubborn about this one. Those tiny leaks? Not worth mentioning to the doctor, she insisted. It's just a few drops here and there. Nothing to worry about. Vivian didn't want to push. Her mom was already sensitive about getting older, and she didn't want to embarrass her further. But 2 years later, what started as occasional drops had become a daily source of embarrassment and odor. Those tiny leaks were creating a much bigger problem than anyone realized. Here's what happens when even small amounts of urine stay trapped against the skin: bacteria immediately start breaking it down, creating ammonia. Over time, this leads to skin irritation and persistent odors that regular washing simply can't eliminate. It's like trying to get the smell out of a cloth diaper just by rinsing it with water. It doesn't work. Families often normalize incontinence as just part of aging, instead of addressing it as what it really is: a treatable medical issue. But dismissing it as normal means missing opportunities to fix the underlying problem and prevent the odor issues that come with it. Any amount of involuntary urine loss should be discussed with a healthcare provider. Many causes are completely treatable. Weak pelvic floor muscles can be strengthened, infections can be cleared up, medications can be adjusted. Proper management prevents odor issues from developing in the first place. But even when incontinence is managed, there's a critical hydration mistake that most people make, and it's the opposite of what you'd expect. Mistake number 4: restricting fluids to reduce accidents. When 82-year-old Cordelia started having accidents, her family's first instinct was logical. If she drinks less, she'll have fewer accidents, right? So they encouraged her to cut back on water, especially in the afternoon and evening. The accidents didn't stop, but something else happened that nobody anticipated: the smell got much, much stronger. Here's the counterintuitive truth about hydration and odor: concentrated urine from dehydration has a much stronger smell and can actually irritate the bladder, leading to more urgency and more accidents. When you restrict fluids, you create dark, concentrated urine that's harsh on the bladder and nose. Well-meaning families think less fluid intake means fewer accidents, but this creates more problems than it solves. Dehydrated older adults are also at higher risk for confusion, falls, and other serious health issues. The better approach is to maintain adequate hydration while being strategic about timing. Encourage more fluid intake in the morning and afternoon, then taper off in the evening. The goal is diluted, lighter-colored urine that's less irritating to the bladder and has much less odor. Think pale yellow, like weak lemonade. Hydration affects odor, but so does something sitting in most medicine cabinets right now, and most people have no idea it's connected. Mistake number 5: medications that affect odor. Estelle was frustrated and confused. She'd always been meticulous about her hygiene routine, and suddenly, nothing seemed to work anymore. The odor was there despite all her careful cleaning and precautions. It wasn't until she mentioned it to her pharmacist during a routine prescription pickup that the pieces started coming together. Her new blood pressure medication could be affecting her body's natural balance. Many common medications can contribute to odor issues in ways most people never consider. Some antibiotics can disrupt the natural bacterial balance. Certain hormones, blood pressure medications, and even some antidepressants can alter vaginal pH, reduce natural moisture, or concentrate urine, all contributing to odor problems. Most people never connect their medications to changes in body odor, so they don't discuss it with their healthcare providers. They assume it's just coincidence or part of aging, missing the real connection entirely. Here's what you can do. Keep a simple log of when odor issues worsen and compare it to any medication changes. Even medications you've been taking for a while can start causing new problems as your body changes. Discuss any connections with your doctor. Sometimes adjustments in dosage or timing can help, or there might be alternative medications available that don't have the same side effects. While medications can contribute to the problem, there's a dietary mistake that's even more common, and you probably never suspected your daily routine could be making things worse. Mistake number 6, dietary triggers nobody talks about. Winifred loved her daily ritual, a strong cup of coffee first thing in the morning, and usually another one after lunch. She couldn't understand why her bladder problems seemed to get worse in the afternoon, why she felt more urgency and noticed stronger odors during certain parts of the day. The connection wasn't obvious until she started paying attention to the timing. Certain foods and drinks can irritate the bladder and concentrate urine odors in ways that might surprise you. Coffee, alcohol, spicy foods, citrus fruits, and artificial sweeteners are common culprits. As we age, these sensitivities often increase, so foods that never bothered you before can suddenly become problematic. People focus intensely on hygiene and medical issues but completely ignore how their daily diet directly affects body odors and bladder function. They'll try every soap and see multiple doctors, but never consider that their morning coffee or evening wine might be part of the problem. Try eliminating common triggers one at a time for a full week each. Start with caffeine, then alcohol, then spicy foods. You might be surprised which foods are contributing to the problem. Keep a simple food and symptom diary. The patterns often become obvious once you start paying attention. Diet matters more than most people realize, but there's one mistake that's so common, yet most families never even consider it, and this is the one that surprised me the most when I first learned about it. Mistake number 7. Hormone changes left unaddressed. At 75, Maxine thought hormone changes were ancient history. "I went through menopause 20 years ago," she told her daughter. What could hormones possibly have to do with anything now? But when her doctor explained how ongoing hormonal shifts continue to affect the urinary tract well into advanced age, everything suddenly clicked into place. Here's what most people don't realize. Declining estrogen doesn't just affect you during menopause and then stop. It continues to affect the urogenital tract for decades, gradually thinning tissues and reducing the natural protective mechanisms that prevent odor and infection. The tissues become more fragile, less able to maintain their natural pH balance, and more susceptible to bacterial overgrowth. Most people think hormone-related changes end after menopause, but they continue evolving and affecting urinary health throughout the aging process. This ongoing change is often the hidden factor behind persistent odor problems that seem to come out of nowhere. The good news is that there are safe, effective treatments available that can help maintain tissue health and reduce odor issues, even in advanced age. Discuss ongoing hormonal health with your doctor. There are topical treatments, low-dose hormone therapy options, and other interventions that can make a significant difference in comfort and confidence. Hormones affect the body internally, but our next mistake involves something external that most people use incorrectly, thinking they're helping when they're actually making things worse. Mistake number 8, improper use of products and pads. Constance thought she was being smart and proactive. She started wearing a panty liner, just in case, better to be prepared, right? But she was wearing the same liner all day, from morning until bedtime, thinking it was protecting her. What she didn't realize was that this was actually making her odor problem significantly worse. Incontinence products and panty liners can trap moisture and bacteria against the skin when they're not changed frequently enough. Many of these products are also scented with artificial fragrances that can irritate sensitive tissues and disrupt natural pH balance. What's meant to provide protection and freshness can become a breeding ground for the very problems you're trying to prevent. People either avoid protective products when they actually need them, out of embarrassment or denial, or they use them incorrectly, wearing them too long or choosing products with irritating fragrances and chemicals. If you need protection, choose unscented, breathable products and change them regularly, even if they don't seem full. Think of them as temporary protection, not all-day solutions. The goal is to keep moisture away from your skin, but that only works if you're actually removing the moisture by changing the products frequently. Our final mistake might be the most important one, because it affects everything else we've talked about today. Mistake number 9, avoiding medical conversations. Rosalind suffered in silence for 3 years. 3 whole years of embarrassment, of declining social invitations, of feeling self-conscious about something that was affecting her quality of life every single day. She was too embarrassed to tell her doctor about her odor concerns. When she finally worked up the courage to speak up, the solution was simpler than she ever imagined, a mild hormone cream and treatment for a low-grade infection she didn't even know she had. Many causes of persistent urinary odor are easily treatable when properly diagnosed. UTIs, hormone imbalances, medication effects, and other medical issues can all be addressed with the right care. But doctors can't help with problems they don't know about. Embarrassment prevents people from seeking help for what they assume is just normal aging, missing opportunities for simple, effective treatments that could restore their comfort and confidence. Healthcare providers deal with these issues every single day. There's nothing you could tell them that would shock or embarrass them. A simple, honest conversation could identify underlying causes and provide relief that transforms daily life. Don't let embarrassment steal years of comfort and confidence from you or someone you love. Now, I know this topic isn't easy to discuss. I can see some of you watching this and feeling a mix of emotions right now. If you're watching because someone you love is struggling with this, I know your heart is breaking a little. You see their embarrassment, you notice how they've started pulling away from activities they used to enjoy, maybe declining invitations or making excuses to avoid being around people. You want to help, but you don't know how to bring it up without making them feel worse. And if you're experiencing these issues yourself, I know the embarrassment can feel overwhelming. You might be thinking, how did I get here? I've always been clean, I've always taken care of myself. You might be avoiding hugs from your grandchildren, sitting further away from people, or declining social invitations because you're terrified someone might notice. The shame can feel crushing, like you're somehow failing at the most basic level of self-care. But here's what I want you to understand, this is not about personal failure or poor hygiene. This isn't about not being clean enough or not caring enough about yourself. These are medical and lifestyle factors that have real, practical solutions. By understanding these 9 mistakes, you're not just addressing an embarrassing problem, you're helping restore dignity, comfort, and confidence. You're taking back control of something that's been controlling you. That's not just healthcare, that's love in action. Love for yourself, love for your family member, love that says, this person deserves to feel comfortable and confident. If you recognize any of these mistakes affecting you or someone you care about, don't wait another day. Don't let embarrassment steal one more moment of joy or connection. Start with the simplest changes, switching to cotton underwear, having an honest conversation with a doctor, or adjusting daily hygiene routines. Small changes can make a dramatic difference, often much faster than you'd expect. Remember, every woman deserves to feel comfortable and confident in her own body, regardless of age. These challenges are common, they're treatable, and addressing them isn't vanity, it's essential healthcare that impacts quality of life in profound ways. Let's quickly recap those 9 critical mistakes that we've covered today, because I want to make sure you remember these when you leave here. First, overwashing with harsh soaps that disrupt natural balance. Second, wrong underwear choices, those synthetic materials that trap moisture. Third, ignoring minor incontinence instead of treating it as the medical issue it is. Fourth, restricting fluids when you should be maintaining proper hydration. Fifth, overlooking how medications can affect body odor and balance. Sixth, ignoring dietary triggers like coffee and spicy foods that can make everything worse. Seventh, leaving ongoing hormone changes unaddressed long after menopause. Eighth, misusing protective products by wearing them too long or choosing scented ones. And ninth, avoiding those crucial medical conversations out of embarrassment. If any of these sound familiar, if you recognized yourself or someone you love in these stories, you now know exactly where to start making changes. You're not helpless anymore. Here's what I really want to know, and I hope you'll share this in the comments below. Which of these mistakes surprised you the most? Was it the hormone connection? The underwear materials? The medication effects? And more importantly, have you noticed any of these patterns in yourself or a loved one? Don't be shy about sharing your thoughts and experiences in the comments. Your story might be exactly what another family needs to hear to realize they're not alone in facing these challenges. If this video helped you understand something important about elderly care, if it gave you hope or practical solutions you can actually use, please subscribe to Elderly Health Central. We tackle the topics that matter most for senior health, the ones that often get overlooked but make the biggest difference in daily quality of life. We talk about the real issues that affect real families, with practical advice you can start using today. Thank you for caring enough to watch this entire video. Taking 20 minutes out of your day to understand these issues shows how much you genuinely care about the elderly women in your life. Keep asking the important questions, keep advocating for better care, and I'll see you in the next video where we'll continue our mission of building better, more comfortable lives for our aging loved ones.